Welcome everyone to NRBP's Diversity, Equity, and Inclusion mini-series on racial and economic disparities. I'm delighted to welcome you all today. I'm Barbara Kaufman, Executive Vice President of Newark Regional Business Partnership. Before we begin the program, I have a few things I want to mention about NRBP, and then we'll get right into our subject today. Some attendees are still joining us, so I'll use this as an opportunity to just to begin talking a little bit about some things that are coming up at NRBP. On November 10th, we're continuing our Eye Opener series, and we're looking at Newark's South Ward. Our particular focus relates to today's topic. We're looking at housing in the South Ward and the efforts by RWJ Barnabas and Newark Beth Israel Medical Center to team with the city, the community, and many others to have quality housing be provided in the South Ward. That's been recognized by many as being an important social determinant of health. And by providing the quality housing, the health of the entire neighborhood will improve. And we'll be talking about some senior housing, affordable housing, many different aspects, about 4 different projects that will be covered, including the efforts by RWJ Barnabas and Newark Beth Israel. We'll also be talking about Newark Beth Israel and the other efforts that are going on there. Then on November 23rd, we're doing our postponed transportation awards. Diane Gutierrez-Sacchetti, the Commissioner of NJDOT, will be our guest speaker, and Huntley Lawrence, who runs the aviation department, will be recognized as our Transportation Person of the Year. And we also have some others who will be recognized for their leadership. What we try to do is recognize people who have been behind the scenes in working in transportation. And the particular focus this year that we want to acknowledge are all of the essential employees who have come into work and have been willing to risk their health to be able to continue to provide transit in a very challenging time. So those are the 2 things that are scheduled. We're in the process of scheduling our postponed gala, which we had hoped to do live, but we've made the decision to hold it virtually, and we'll be announcing a date for that. And we'll also combine that with our holiday celebration. And the 2 awardees for that gala are Barry Ostrowski, the CEO of RWJ Barnabas, and Mayor Ross Baraka. It's a hand for Barry, for sure. So those are the things that are scheduled for this year. We're going to be announcing one more networking program that will be later in November. We're trying to do our best to keep the networking going. Online is not quite the same as in person, but we are trying to continue to connect our members. I will mention that we've stepped up our member care, which is the initiative that we use to be able to make introductions. So if you're interested in that, please contact any one of us, and we'll be happy to make introductions to hopefully help you do more business and to connect with the resources that you need. Before getting into today's topic, I just wanted to say that this series was prompted by the fact that systemic racism was underlying, and that COVID just further exposed the cracks in the system and revealed why we really need to address the disparities that occur in so many different ways. And we are happy that we're able to, through this series, provide information that allows our members to become more informed. This is part of a 3-year effort that we've led on diversity, equity, and inclusion. We've offered some training. We're planning on continuing that training offering in 2021. And we also have done intercultural lunches, which we also hope to continue in 2021, at which we offer a chance to break bread and talk about cultural, racial, economic, all sorts of differences. And hopefully by educating, we're able to have to breed greater understanding. Last thing I want to mention is that for Executive Women in New Jersey, where I'm completing a term as president, Chris Purnell from University Hospital spoke at noon today about the power of narrative medicine. And it was a really fascinating presentation. And one a technique that she believes helps to bring about more equity in medicine. I know that we'll be able to share that afterwards. We did record that, and we'll be able to share that as well as her presentation. She welcomed us to do that. It's now my pleasure to explain the format for today and turn it over to Ebony Davis. The format is that we're going to spend the bulk of the time with the presentations facilitated by Kerry Lagoso-Mizarel, and she will introduce our panelists after Ebony begins. Then we will pause at about 2:40, 2:45 to see if there are any questions. You can post your questions in the questions box. There will be messages that Maya Curry, who leads our diversity initiative, will post in the chat area, and you can refer to those if there's any references that you're interested in following the program, that those will be posted there. So with that, it's my great pleasure to introduce our series sponsor from Quest Diagnostics, Ebony David, who is Executive Director of Human Resources at Quest Diagnostics. Ebony, it's all yours.
Thank you, Barbara, and welcome everyone. We are very excited to be here and more excited to sponsor. 2020 has been a heck of a year for many of us for many different reasons. Quest, we lead, we like to say we are the leading lab in diagnostics. With the pandemic that we are still in, we were one of the organizations, like many other individuals, who thought this would be something short-lived. We thought it would be a blip. We did not know it would be and take over the world as it has. We started preparing for this in January, and in March, we were in a full pandemic. That pandemic was around COVID-19. And our workforce, we have 48,000 employees, more than half of them are considered essential because we were thrown in the pandemic to actually process the testing. And we've been the largest lab processor in the country thus far. That pandemic was one that started in March, but another pandemic came upon us in May and June. And that was brought on by the murder of George Floyd. And Quest, like many other organizations, sat in a room similar to the one we're probably sitting around virtually and talked as an executive team and said, we cannot sit silent. This is something that's impacting our employees. It's impacting our world. And we have to do something, and we have to do something different. Because those of us who've been in diversity in any way, shape, or form, we've been in it a long time, and we tend to have the same conversations over and over again. And our CEO said, Ebony, you lead our efforts, and I need them to be different. I need us to walk out of this conversation different than we walked in. And so we decided to do things a little differently. And sponsoring conversations like this is one of those differences. And not showing up as a lab leader, but showing up as a member of our community that wants to make a positive difference. And that's why I'm here, and that's why we're sponsoring. So thank you, and I'm gonna hand it over to Kerry, who will get us started.
Thanks, Ebony, and thanks, everyone. Hi, I'm Kerry Lagoso-Mizarel, and I'm the Executive Director of the Greater Newark Healthcare Coalition, which is one of 4 nonprofits in New Jersey designated as a regional health hub by the New Jersey Department of Human Services and supported by the New Jersey Department of Health. There are sister regional health hubs in Trenton, in Paterson, and in Camden. And the hub vision is health equity for residents of the areas we serve. So for us, Greater Newark. And our mission is to work collaboratively to improve the systems, the community, and the individual conditions for optimal health and well-being. And the hub's 4 core functions really are to act as a neutral convener for multi-sector partners, to facilitate data sharing and interoperability. We test innovative strategies, and we also inform healthcare policy and advocacy. And some of the work in our region includes a focus on better engaging faith-based partners in the management and prevention of chronic disease related to obesity, testing multiple strategies to improve grave disparities in maternal and infant health outcomes, working to re-engineer the school provider and caregiver relationship to improve maternal and infant health, and really creating a robust data infrastructure in our region to allow us to do the work and know how well we're doing the work in the domains we're focused on. So personally, I feel very inspired to be a part of today's effort, both because of the alignment with the mission and vision of Greater Newark, but also because we have panelists here today who I greatly admire, I respect, and I appreciate. So as you know, I think we are here today to talk about and learn about implicit bias and economic disparities and the impact that those have on diverse communities and how they access and engage with healthcare. And we're going to talk about things like access and quality and innovation, and also the role that the business community can play in learning about these important issues and supporting efforts that you're going to hear about today. So before we jump in, I'm going to ask each panelist to introduce themselves by sharing their name, their organization, and their title. I'll start with you, Dr. Elnahal. Welcome.
Thank you, Carrie, and I want to thank the Newark Regional Business Partnership for inviting me to this panel today. I'm Sharif Elnahal, proud to be the president and CEO of University Hospital of Newark.
Dr. Rogers.
Good afternoon. My thanks as well for being asked to be part of such an illustrious group. I'm Denise Rogers. I'm Vice Chancellor for Interprofessional Programs at Rutgers Biomedical Health Sciences.
Ebony, we heard your intro, but if you could say hi. And then Micheline Davis. Hello and welcome.
Thank you so much, Carrie. Micheline Davis, Executive Vice President and Chief Corporate Affairs Officer at RWJ Barnabas Health.
Great. And Ebony, turning it back to you, thanks again first for sponsoring today's event for Quest's partnership in that regard. It's my understanding you're in human resources, and so I was wondering if you could perhaps offer guidance to employers who are listening regarding the need to both be aware of and attend to the realities that a diverse staff, and especially African American and Hispanic employees, are navigating in the wake of COVID-19 and within the national landscape you mentioned, which is riddled with racial injustice. Oh, I can't hear you. Can others hear Ebony? No, okay.
Hang on, no, I'm trying to unmute her.
Okay, thank you, Maya.
Perfect. Sorry about that. I couldn't unmute. So yes, this has been a journey for us as an organization, and one that we definitely was not on our priority list to be dealing with this year. But like pandemics, I'm learning you don't get the chance to prepare. And as the inclusion and diversity leader, I can tell you, being in the middle of COVID, we learned the word of the day was disproportionate. And what became clear is that African Americans, Latinx, Native Americans were disproportionately impacted by COVID. And it was a few months into the pandemic when those numbers became blatantly obvious. What we learned as an employer is not only was our workforce impacted because we were essential, we had to work during a pandemic where people were afraid to leave their homes, but we needed them here to process the testing so we could know and help these patients get on the road to recovery. At the same time, many of our African American and Latinx employees were dealing with COVID, whether it was personally in their home, a family member, or someone they knew. It was more than a news story for many of our employees. In the midst of that, with George Floyd being murdered, Breonna Taylor being murdered, Ahmaud Arbery being murdered, it became very clear to the organization, and I can say personally to me, that people of color were not okay. And many people not of color were not okay. And as an organization, we needed to do something about it. So we actually implemented a balance program, which is focused on mental health. We had luckily implemented earlier this year. Our chief medical officer at Quest is someone who's shared his journey personally through depression. And because of his personal experience, he brought that benefit to our entire workforce. And it's something we've been a priority of ours, mental health. And as we went into it, we realized not only do we need to treat our employees, from a benefit, we're used to talking about medical benefits and physical health. And now we need to talk about mental health, because this was taking a toll on all of us. And so we not only reissued and re-educated and recommunicated, we encouraged people to use those mental health benefits. And one of the things that I thought that was most powerful is we had a conversation with 2,300 leaders about racism and about how employees were feeling. And we put a diverse set of leaders in front of 2,300 people, 3 of them to be exact, 2 African-American leaders and a Caucasian leader. And we had them tell us their journey through diversity and their adversity with it. Some of them adverse, some not so adverse. But it was a very heartfelt conversation. And we gave them tips and literally said out loud, some of your employees aren't doing okay. And I said in front of those 2,300, I'm one of them. I show up to meetings with the CEO. I get off the call and I cry because my cousin was in the hospital fighting COVID-19. And then I come right back on the meeting, wipe my eyes, and I wasn't okay. And because I'm more of a senior executive, I'm more comfortable. For my specimen processors, they don't have the words to articulate to you they're not okay. You think it's a performance issue. It's not. It's a pandemic. It's not COVID-19, it's now racism. And then today, it's now a pandemic on women in the workplace, because majority of us are being impacted and having to take care of our family because schools are closed, because people are not healthy. And so we as a company decided we're going to deal with all of it, and we're going to make it our priority. We're going to support our employees, we're going to support our patients, and we're going to support the communities in which we operate.
Thanks, Ebony. I'd like to turn to Dr. El-Nahal. First, thank you for the courage and commitment you and the University Hospital team have been demonstrating tirelessly in the wake of the pandemic. And I think taking a lead from Ebony, as the CEO of the hospital most impacted by COVID-19 cases, how are you supporting your team to address COVID while also continuing to attend to other community health needs?
Well, let me just start by saying that the courage that Ebony just displayed to this group of people is the same courage that we tried to display in terms of our leadership here at University Hospital, because we saw firsthand, and I made sure of that as the leader of the institution, all leaders, managers were side by side with the front line as they were putting their lives at risk, going in and out of patient rooms at a time when a disease which we knew very little about was causing very adverse outcomes and deaths at levels that we've never seen before. This is something that I try to emphasize in every forum, every panel, every opportunity I get to speak to people en masse, which is what we saw at University Hospital and what all hospitals saw in the middle of the global epicenter of this pandemic at one point was like nothing we've ever seen before in healthcare. The experience that didn't just last one night or 1 week, several weeks, several months, where we were seeing people in record fashion passing away, having long-term complications, and continue to see folks dealing with the aftermath of this terrible disease. That is what we saw in the hospital on the front lines of this pandemic. And our staff went through something that would make anybody at risk of experiencing post-traumatic stress. We recognized it at the time it was happening. We were there on the front lines seeing it as it was happening. We provided hazard pay. We called it hero pay because one night rounding at 11 p.m. on my mother baby unit, having a nurse cry to me saying she's never had to face something like this before, was all it took when we were in the most uncertain financial position you can imagine. But it was all it took for me to decide that we had to do it. And that isn't just bonus pay. It is also psychosocial support services. It is chaplaincy services for folks who subscribe to faith or spirituality. And it is support from all angles, including peer-to-peer support for folks who weren't okay, feeling better, who may recycle back to not being okay. And it is so much more in terms of the daily support we had to provide for each other. We emerged from this, and we're again re-entering a second wave now, but we emerged from that initial surge a stronger team than I've ever seen a team in my career. That's the one silver lining from this. But that was only because leaders had the courage to be in the fight with the front line here, but also we were there with every program you can imagine to try to support people through the crisis while it was happening and continuing to do so as people are triggered when they're starting to see new cases of COVID-19. It has to be mentioned because this is the topic of the panel today. You couldn't help but notice that as you were trying to support the front line, that almost every person in our patient rooms was a person of color. We proudly serve a majority and minority community at baseline. But the disproportionate impact of this disease on people of color, the people who comprise the majority, overwhelming majority of essential workers, the people who are more likely to live in congregate living, the people who are, at baseline dealing with chronic conditions and are more likely to be low income, that depend on our hospital. Still disproportionately, we saw people of color devastated by this pandemic. And to recognize that and highlight it with data is one thing, but we have to work together collectively as a society to make sure that the next crisis doesn't perpetuate and rip open the existing cracks by sealing those cracks proactively with these types of discussions and subsequent action. Thank you.
Great. Dr. Rogers, if I could turn to you. First, I want to publicly thank you because you serve as our board vice chair of Greater Newark Healthcare Coalition among the many roles of service that you have. So we're grateful for that. Dr. Al-Nahal just mentioned, and Ebony also mentioned the huge disparities. And I'm wondering if, from your perspective as a family doctor, as an educator, and as a scholar, if you can shed light on the underlying conditions that relate to these health disparities, and particularly relating to COVID-19.
So as all too frequently the case whenever I'm on a panel with Dr. Al-Nahal, mostly I just say ditto. So thank you, Dr. Al-Nahal. But I will reinforce some of what you said. So essentially what we know is that many in communities of color don't have jobs that they can do from home and are on the front lines. They're driving buses, they're collecting the garbage, they're bagging groceries. They're doing those jobs that allow the rest of us to keep functioning in society in the midst of this pandemic. They also are more likely to take public transportation, and so are more likely to be exposed to the vaccine. As Dr. Al-Nahal noted, the other problem is that particularly in African American and Latinx communities, there are higher proportions of people with chronic underlying diseases, things like heart disease, cancer, diabetes, and the like, that then predispose people to have more complications and also predispose people to dying. It's important, though, that we never talk about health disparities without talking about racism. Because if we don't talk about racism, we too easily leave people with the impression that these health disparities are just because people don't care about their health or don't want to do the right thing. And the truth of the matter is that we have a very long legacy of racism that has contributed to differential access to healthcare, differential access to education, differential access to housing, all of these things that are social determinants of health that contribute to adverse outcomes. And so I really want to reinforce the last thing that was said, which is there are many, many band-aids that we need to put on this situation now in order to help people survive. We need to make sure that the rental moratorium, the eviction moratorium rather, remains in place so that we don't have huge numbers of people thrown into homelessness. We need to make sure that we're providing adequate food for people. But the truth of the matter is, it is incumbent on all of us to learn the lessons, not only from this pandemic, but also from the significant racial unrest that leave us committed to making a difference to create a more just and equitable society. That starts, certainly for me as a physician, with everyone needs access to healthcare. We need universal access to healthcare in the country. In this country, we're the only developed country in the world that doesn't have universal access to healthcare, and we should hang our heads in shame over that. But we also need to make sure that people have adequate income and food and housing and those things. And we are the richest country in the world. We can do this because if all we focus on are these short-term solutions during this pandemic and we don't make these longer-term changes, we will go through these cycles over and over and over again, and a significant proportion of our society will inappropriately suffer or disproportionately suffer from our lack of action.
Carrie, I think you're on mute.
So sorry. Trying to be polite and I overdid it. Micheline, with your role at RWJ Barnabas Health and as they're being one of the largest employers in the state and New Jersey's largest healthcare system, I'm interested in your contribution both from the state landscape and the national landscape about this topic and your perspectives on what we're talking about today, health disparities, the impact on the employees, the impact on patients, and then also, as Dr. Rogers just stated so well, the convergence or the underlying impact of a long history of systemic racism.
Yeah. Carrie, first of all, thank you so much for giving me an opportunity to be here with these incredibly esteemed guests, my two dear friends, Dr. and Dr. Just good to be here with you. And quite frankly, to everything that they have said, I feel like yes and amen. The interesting aspect is that while they both have medical degrees, I have a Juris Doctorate. And so I look at all of this through the lens of, right, so what are the policies, systems, and laws that have really worked to create this inequity, right? We like to say sometimes inadvertently, but the truth is that oftentimes it was by design. And that I want to make certain that we also acknowledge that in order to get lots of articles of legislation through at the congressional level, et cetera, there were lots of deals made which cut out certain segments of the population. Those segments are now residing in those communities that have been redlined into those communities, and as a result are suffering that disproportionate impact that my friend Dr. Elna Hall referenced earlier, and undoubtedly that which Dr. Rogers referenced. I will tell you that across our system and across the country, we are seeing the fact that hospitals are not merely staying on the sideline around the issues that are the root cause of the root cause. Rather, they are, I want to say, running into the fire that is set upon us, right? So here we are both in a global pandemic and an international revolution that is an awakening of sorts around racial injustice that has created the structural systemic inequities that COVID-19 has magnified. Well, what I will tell you is, if you take a look at some of my sister institutions like Rush Medical Center out in Chicago with my dear friend, Dr. David Ansel, I can tell you two things. One, that they, working with the mayor there, actually created a racial equity response team in the height of the pandemic there, so that they were not waiting until after they got through that height, but that they were at least trying to track, measure, and intervene where they could based on what it was that we were seeing, which was exactly as Dr. Elna Hall just referenced, right? We were seeing hordes of individuals in healthcare systems that unfortunately were in dire straits that all look the same, right, or similar. And hailed from these particular backgrounds. The second thing that healthcare systems are doing across the country, and undoubtedly we are doing as well, is taking on the real issue of not just racial injustice, but racism by calling a thing, right? So we're actually addressing it in that way. Ebony referenced the recent deaths that really culminated in ushering in the focus and attention, but we also note and understand that those were just some of the deaths that have actually occurred in very similar manners. As a result of that, our CEO has actually launched us onto an anti-racism journey. He really has a commitment to becoming an anti-racist institution, and wants for us to make certain that we have that at the forefront of almost the frontal lobe of our organization as we take a look at our practices, our policies, right, and our processes across the system. But I will tell you, again, sister institution Rush out in Chicago actually had 3 years ago adopted dismantling racism as a part of their strategic plan. I mention them so often because we're in a thought partnership together, as we are with several other entities across the country. But I want to mention this one in particular. We happen to be, RWJBH happens to be a co-founder of something entitled the Health Anchor Network. The Health Anchor Network is some 80 hospitals, large scale and small, across the country that have committed to really embracing an anchor framework, right? So an anchor mission to doing their work, which I know that both Rutgers University and University Hospital undoubtedly has done as well. Well, what I will tell you is recently they've just released a statement on racism as a public health issue. And in addition to that, the additional element is that we are at present working on the development and application of a racial equity assessment tool that can be applied to performing anchor work, so that every institution that is committed to being both in and of their community now has, right, a methodology to utilize to ensure that the intent is matched by that effort, right? That it really shows up in the ultimate effort, that they're going through the scrutiny of asking the questions around, who has been historically marginalized or disenfranchised by existing policies, what policies need to be changed, how can we do this, how can we approach this in a manner that recognizes the marginalization of these peoples. So that's an exciting element of all of this. But I have to say this too, that to Dr. Elna Hall's earlier point, the mental health aspect, and to Ebony's transparency, the mental health aspect of this cannot be understated, cannot be overstated. And as a result of that, in addition to, of course, creating what many healthcare systems did, which was to really gather all of our different component parts, our employee assistance program and our behavioral health network and a variety of other things in order to package them under one umbrella to really remind individuals, listen, you have this at your fingertips. We also began to look around and realize, so the pandemic is the first pandemic, racism is the second. What are we offering there? To that end, we've actually launched a racial trauma behavioral health subcommittee that is literally working with the New Jersey Black Psychologists Association and the Association of Black Social Workers in the state of New Jersey in order to create a variety of offerings for both our employee base, but also our patients and a general community to utilize, right? So they range from everything, including but not limited to a listening line where individuals can call up and in partnership with the Black Summit in order to talk about how you're feeling right now, right? With someone else who has both that trained, but also that lived experience, which is different and unique. They're coming on board in order to train our majority practitioners so that we are aware of and sensitive to the need to ensure that we are addressing racial trauma in that clinical setting. So that's just a bit, and I don't want to take up too much time, but I really wanted to add to that, Carrie, in order to answer your question. So thank you.
Thanks, Micheline. Thinking of going in two different directions. I'm going to turn to Dr. Elnahal first. A lot of what we've been talking about shows up from the patient or community side as mistrust in systems, right? And there's a lot that goes into the history and the feelings that people have. And I'm wondering, we know that University Hospital is one of several hospitals engaged in COVID-19 responses, including a vaccine trial to hopefully get us to a brighter day on that regard. And I'm wondering how you're experiencing the mistrust or the complexities that we're talking about in the community response to the vaccine trial and to the other COVID work you're doing at large.
I'm really glad you asked about that, Carrie, because I do think a broad understanding of this issue isn't just important for hospitals or healthcare institutions. It's literally important for every organization that has an employee base that's an anchor, that serves the community, that benefits from the community. They need to understand this issue. You're dealing with a history in this country where Black Americans were unjustly experimented on medically and otherwise mistreated by the scientific establishment in general. That dates back to the time of slavery, when a physician named J. Marion Sims decided to experiment with gynecologic surgeries on Black enslaved women until he perfected them. So many other examples, leading to one of the most egregious recent ones, which is the Tuskegee study, which followed a group of Black men who had served this country in the military, knew that they had syphilis, refused to treat that syphilis on purpose so that they could track the quote unquote natural history of chronic syphilis, which can be a devastating disease. And the reason we know so much about what can happen to somebody with untreated syphilis in the long term is because of this study. While that added to the pie of knowledge, it did so at the expense of Black Americans to an inexcusable level, and that will never be forgotten. It will never be forgotten in communities of color. This is what people have told me of all stripes in our community: faith-based leaders, community organization leaders, folks that we've talked to in focus groups, different sessions with our research team in partnership with Rutgers, New Jersey Medical School, who's actually conducting a COVID-19 vaccine trial. That will never be forgotten. It is our responsibility as stewards of this community, with the privilege of leading organizations in this community, to set the table with our community in what is going to be a Herculean effort to ultimately get both vaccines and the right therapeutics as a matter of equity to the community that's been devastated most by this. So I spent most of my first answer talking about how much this hit Black and brown people the hardest. Now the task at hand is to not only obtain the resources and interventions to get our community out of this pandemic, but to convince and do so humbly by approaching the community humbly that it's the right thing to do. You're working against a terrible history, and we have to be the ones to prove to this community that this stark contrast between what used to happen in terms of exploitation of communities of color, what we're trying to do now, which is to help the community, is stark and it's different. They have to trust not only the science behind what's happening, which means you have to involve them in the science and understanding the science, but they have to trust the people actually delivering the interventions and conducting the science. And the only way to establish trust is to humbly approach as many people as you can in the community with any degree of influence with these appeals, with the information and with the facts. Another current that we're fighting against, in addition to our horrific history with medical establishment in the Black community, is the fact that, unfortunately, the institutions that used to be completely free from political influence in Washington have since become influenced. And I don't say that as a matter of politics, I say that as a matter of fact. I trusted the FDA and CDC in the Bush administration. I trusted the FDA and CDC in the Obama administration. I learned about the FDA and the CDC in the Clinton administration. It didn't matter. It didn't matter who was in the White House and which political party was dominant in Washington. These institutions are sacred. They're run by career civil servants for the most part, who act on fact and based on fact. Because of that underlying current, there is a deep mistrust, especially in communities of color, of what will ultimately, hopefully, get us out of this pandemic, the science behind it. And so what we have to do is arm the people with the most trust in our community, the doctors and the nurses and the clinicians that already have people's trust, faith-based leadership, community-based leadership, with the facts, and encourage folks to understand that the people conducting the science aren't the people elected to office. These are people who've been doing this work for many years. The principal investigator at our hospital has done HIV research with Black and brown people in this city for decades, and she has brought these therapies to our community. And the only way to do that, again, is to encourage people not only to be convinced, but to be spreaders and purveyors of truth. Unfortunately, it's a phenomenon that normal people who act based on fact are not as vocal and are not as active on things like social media, which are propagating machines for misinformation and disinformation. One point that I like to make, it's very telling that foreign adversaries are amplifying and inserting misinformation about vaccines, including childhood immunizations, into our conversations purposefully. They're doing that because they know it's destabilizing, and they're doing that to encourage more and more mistrust in our institutions. We have to fight back by approaching the community humbly and amplifying the truth and asking our allies to do the same.
Thank you. Wow. Dr. Rogers, I was hoping to revisit an earlier conversation where we've been talking about mental health, and two resources that were held up are traditional clinical, therapy, and I heard the helpline mentioned and peer support, like in that regard. Thinking about the Believe in a Healthy Newark work you lead and other areas of our work, I was wondering if you could speak to some of the other actionable strategies or approaches that have been shown as promising to helping people navigate and optimizing their mental health.
Yeah, thank you, Carrie, for that. So I actually want to get back to Ebony's very powerful statement. We're not okay. None of us are okay, actually, because we're living in a world where we're fearful of a virus that we've never seen before. We don't even know if people who've already had this virus are immune from this virus. There's evidence actually that a subset of people can get it again. So we are all afraid. So imagine being afraid and layering on top of that, being afraid of losing your home, being afraid of losing your job or having lost your job, being afraid of not having enough to eat. There is no question then that solely related to COVID, we have a mental health crisis. You layer on top of that the public lynching of George Floyd and all of the other unwarranted killings of Black men in this country, most recently on Monday night in Philadelphia, we get further traumatized. And this trauma is very different depending on who you are and what you look like. So COVID trauma is a little bit of a great equalizer. Racial injustice trauma is not. Racial injustice trauma impacts people of color in general far more than it does whites, because this could be my brother, my cousin, right? So one of the things we focus on is sort of traditional therapeutic interventions. Another thing we should focus on, in my view, and particularly for the business community, are things that we can do to promote the mental health of employees and everyone. So do we make time for people to be able to go outside and take a walk? Do we make time for there to be emotional and psychological downtime for people? I am a huge proponent of the significance of both a mindfulness practice as well as exercise in terms of helping us deal with our mental health stressors. We know from the work with trauma, from our ACEs work, that a mindfulness practice and exercise can go a long way in helping people to be able to better cope. And there's physiology around it that I won't go into. We can create work environments that respect people's need to do that. We can create work environments, for example, a mindfulness room where employees can go and sit for 10 minutes with low lighting and plants and calming music, so that if people need to take a break, they can do that, because it is incredibly stressful. Now, the sad reality as I speak these words is that in many instances, the very people who need those types of interventions most are least likely to get it. So what's the likelihood that a bus driver is going to be able to take a break in a room with a quiet room and plants and the like, right? But we can still educate that bus driver about the importance of engaging in a mindfulness practice either before going to work or after coming home from work, and also getting some exercise. Because if we think that the only solution is traditional therapy, we know that for the vast, vast majority of people that we need to serve, it's not available. It's financially out of reach. There aren't enough clinicians able to do it. And so we need to be more creative in terms of how we think about developing community-based and family-based resilience and interventions.
Thank you, Denise. Looks like Barbara's joining us. I don't know if there was a question, Barbara.
Yeah, thank you, Carrie. Denise, picking up on your very eloquent statement that you just made, and very, very important. Many of NRBP's members are small and medium businesses that don't have an Ebony David, that don't have the person who is thinking every day about how do we help our employees. So my question, our question is, from all of you, what can we recommend to those small and medium businesses, to the heads of those businesses, to be able to provide support and the space that you're talking about, and also access to resources? How do we help equip them?
Well, my first response is the reality that very often those same owners of small and medium businesses are as distressed as their employees are, because they are very economically insecure and so are very worried as well about their own sustainability. So you add on top of that then the need to be empathetic and compassionate with employees, and that's often a stretch. And so one of the things I would encourage these employers to think about is what would be beneficial to them. Now, unfortunately, the ethos in this country too often is you just need to suck it up, because anything short of sucking it up is a weakness. And yet all of the data, everything's going in the wrong direction in this country. Substance use disorder is significantly increasing. Suicide is significantly increasing, and often increasing in the populations that we're now talking about. So as you are sitting in the audience listening to me, and as you're saying, absolutely, the answer is suck it up, I want you to then say to yourself, it doesn't work, because it's not working for so many people. And so there are simple things. So one of the simple things is, how do I create space for people to take a break? But the other piece is, how do I also make sure that people are educated with the facts? Sharif talked about, there is so much garbage out here on the internet. It just astounds me. I'm horrified by it. It gives me pause about the First Amendment, Micheline, which I'm sure would horrify you as a lawyer, but I just like, why do we allow this crap to exist out there? That was a medical term, by the way. And so it becomes important at a minimum to educate people about what we know about COVID and what do we know about the prevention, and make sure that people have masks and make sure people know how to protect themselves and their families, because that too can help reduce the anxiety. I'll turn it over to others.
So one thing I'd add, Barbara, is I think Dr. Rogers hit it on the nail, hit the nail on the head, that there are so many things that do not cost money. Having a conversation, asking a person how they're doing, and actually waiting for the response will help the individual actually give the wrong answer. Because as we talk about systemic, right? It's systems, it's things we do naturally. Ebony, how are you? I'm fine. Suck it up because I'm fine and you don't care anyway. And to actually stop and say, Eb, I know you're not fine, but when you're ready to come talk to me and listen. It's the free therapy. There's no copay for it. Every boss can do it. Every colleague can do it. And I know in the time of COVID, we can't touch, but the power of touch is also something. I'm not a doctor, but a hug, when you haven't had one in so long, it literally cures whatever's at least on the surface. And so that is free. You don't have to hug them, but have the hug them when you can, when COVID's over, but have the dialogue, have the conversation, and hear them. I think that's also one of the many issues wrong with our country today is we are only spouting our own agenda or what's on our mind versus pausing and listening to those who aren't always listened to. It's free.
I would just add to that, one thing that we're also trying to do at University Hospital is being there for folks when you can, when you know they're not fine, as Ebony just mentioned. But also, there's never been times when I've remembered praise more than when it was from a peer. When somebody who does the exact same thing I do as a student or a resident or whatever stage in life I was, who saw me do something and said, you know what, that was great. You should really be really proud of that. To have an organizational culture that fosters that, to of course be there for people when they're on one end of the spectrum, which is absolutely necessary, but to also help prop people up to the other side of the spectrum, where people say, you know what, that was amazing. You really helped that person. And I respect that, and teach me how to do that. However you convey it, that can mean a world of a difference. You can make someone's week, month, year by doing that. And we do these weekly town halls, and every sort of speaking opportunity, I remind folks to start doing that. And we're starting to see a little bit of that change, despite the post-traumatic stress, despite the fact that people are triggered, despite the mental health crisis that COVID has caused, and also surfaced existing mental health issues that people may have been suppressing. Just an important cultural element that folks should really try to strive for.
Carrie, I just want to also mention in our prep call, Dr. Elna Hall had talked about the changes that are being implemented in University Hospital to make her hospital more community focused and embracing of the community. So I thought maybe you'd want to comment a little bit more about that.
Yes, thank you, Barbara. I'm happy to. So we're really proud to launch our new branding through a letter to the community. So one thing I really wanted to do was paint the picture for what University Hospital should be and has been expected to be since its founding, with a direct communication to the people we serve, first and foremost. And if you look at our hospital's history, it is completely interwoven with the history of the city and the history of racial tension in the city. We displaced the most prosperous Black community, one of the most prosperous Black communities in the country, when our campus was founded and built. And that's never been forgotten. We were rededicated to the community after the riots in 1967 that caused significant unrest, with yet another boiling point in our history of racial tension as we're experiencing right now. And part of the Newark Accords, which ended that violence, again rededicated our hospital to the community. The extent to which we've satisfied those requirements has been variable over time, but what we wanted to convey was the fact that that's going to be the guiding force. The North Star for us is meeting the intention and the promises made in the Newark agreements. We're proudly a public institution, and that comes with all sorts of resources and oversight and everything you would expect out of a public institution. But unless you have leadership that specifically calls that out as an organizational priority, you can still miss the mark on the most important thing. And so we're really excited about that at University Hospital. I felt it was needed. A short time after I got here, it took a while to sort of get the story put together after diligent engagement with the community, but we're very excited about it.
Barbara,
One
we
other
can't
question.
hear you. Yep. Okay.
Yep, I just realized it. Yep. One other question. Many clinics are running out of immunizations to attend school. Mental health resources are also needed. What resources do you have for parents needing health care and food for their children? So it's a multifaceted question.
Well, so there are different aspects to the different parts of the question. Let me start by saying the most important thing is if you're running out of access to food, for example, a really important access is 211. Because 211 can give people very specific information about where you can access these resources. I strongly encourage people, those of you who are in need, to utilize that resource, but also to make that resource more widely known to everyone in the community as a place that they can turn for these needs. In terms of childhood immunizations, they sort of wax and wane in terms of their availability, in part just related to how the VFC program works, which is the Vaccine for Children program, and how institutions are sort of forced to use vaccines before they can get more vaccines. It's just backwards, but that's just my opinion. And so just hang in there, because more vaccines will become available. It's not like we have a national shortage of childhood vaccines. It's just that, you just have to be persistent. The mental health piece is a lot tougher. And so obviously, if there is an acute mental health situation, University Behavioral Healthcare has a hotline. Obviously, there's the National Suicide Prevention Hotline. But it is, I will confess to you, challenging to get sort of baseline mental health services for children, particularly depending on insurance status, because we actually don't treat mental health like physical health and reimburse it to the same extent that we did. And so that's where I also advocate for all of us to partner together to become champions for a change in that aspect of things. But my most important takeaway is 211. Call 211.
Thank you, Barbara. Unless there are other questions, I think this is probably the right place to end, and also to really thank all of the panelists. Feel like you've done an equally amazing job of opening minds and I feel like hearts as well, because the compassion and the commitment really comes through in your conversation today. So with that, I would like to turn the program over to Chip Halleck, who's the president and CEO of NRBP, who's going to offer closing remarks. And thanks, everyone.
It would be something of an understatement to say this is a hard act to follow. I think this has been one of the most compelling hours that we've had, not only in this series, but in the programs that we've been running virtually since we started. So I thank you all. Excuse me. Kerry, thank you for the leadership that you provided today, and also for being at the nexus of creating the health equity in Newark. Very grateful for your contribution here today and your leadership consistently throughout. Ebony, thank you for opening this with such an honest story about yourself, as well as how to deal with employees, and having that conversation and really trying to understand the adversity that they're facing when some of us may not be part of that. So it's so important. And Dr. Elnahal talking about the courage of those frontline workers, and certainly the same thing in the RWJ Barnabas network. And people who've been under siege for months and apparently are going to be under siege once again as this pandemic worsens. So thank you for all that you do and all the people that you lead that take care of us and try to keep us all safe. And Dr. Rogers, talking about the legacy of racism and not being able to and the mindfulness that's important. You can't just suck it up, and that's something for all of us to remember as we deal with our employees, deal with our friends, and deal with our neighbors, and trying to provide that support whenever possible. This series and all that we've done in our diversity, equity, and inclusion series we consider very important. And I think Dr. Elnahal said that we need to be spreaders and purveyors of truth in advancing racial equity. And that's certainly what we are trying to do here. And we want to further the conversation and not just have conversations, but have conversations that can lead to action to address the terrible disparities and years of racial discrimination that has taken place in this country. So we will be continuing the conversation. We thank you all for your thoughtfulness today, your passion, and being so forceful in your convictions. I think it helps to inspire us all and hopefully lead to much better days. So with that, we certainly ask you all to be well, take care of yourselves, and by the way, vote. Thanks all for joining us.